Well, we have a lot of information to cover, so we'll get started. Again, it's that time, it's open enrollment, and I emailed you information this morning. I've done my best to really summarize it for you to try and make it simple. So the information that was emailed this morning really summarizes everything that I'm going to share with you this morning. So I encourage you to download that attachment and read it, print it off so you can refer to it from time to time. But I do want to give you an overview of the information that was sent to us from Atlanta. The information I plan to cover today about state health has to do with the dates of enrollment, the options available, the benefit changes, wellness initiative, something called transition of care, which is going to be very important for some of us. Affordable Care Act, I won't spend a whole lot of time on that. I will just give you what our responsibility is to our employees under the Affordable Care Act. The website for open enrollment will open at 12 a.m. on October 21st and close at 5 p.m. on November the 8th. If you are very ambitious, wake up at 12 o'clock and do it on October 21st and get it out of the way. But you will have 3 weeks this year. They've shortened the open enrollment period because of processing issues. So please do not wait until the last minute. Year after year, we experience problems with the portal the last few days of open enrollment due to the high volume. I encourage you to go on as soon as the portal opens, make your election, keep your confirmation, and you'll be done with it. This is the website to go to for the open enrollment election. It's myshbpga.adp.com. That's also in the handout that was emailed to you this morning. It's going to be available on our website with a direct link if you have any questions about that. You can, of course, go online as many times as you like. Whatever your last election is what you will be enrolled in. So if you go in and switch back and forth, you can do that as many times as you like. But on November the 8th at 5 p.m., whatever your election choice is what you'll be enrolled in for plan year 2014. We also, again, encourage you to keep a copy of the confirmation number that shows you've completed the enrollment, and it shows what your election was. Blue Cross and Blue Shield of Georgia has been awarded the contract. People have asked, why do we switch? Why are we switching? And I'll just let you know, every few years the contract comes up for bid. It was explained to us that Blue Cross and Blue Shield offered the best product for the premiums. So Blue Cross Blue Shield will be our third-party administrator this year. Effective January the 1st, that's who will process all of our claims and our billing. We are supposed to get new cards by mid-December for Blue Cross and Blue Shield of Georgia. Express Scripts will be our pharmacy benefit. Years and years ago, we had Express Scripts. It has previously been Medco, so we're going back to Express Scripts. Healthways. Now, this is something that's going to be a little bit new to us. Healthways will be our wellness vendor. It was explained to us that that's all they do, wellness. Initiatives, incentives. So they will actually be the vendor for our wellness. So you know how we've gone online and taken those online health assessments, what have you. All of that will be administered now through Healthways. So that's something that's new for us this year as well. Express Scripts and Healthways, they're working closely on an ongoing basis. I encourage you, if you have any prescriptions, anything that you know that you're going to need going into the year, try and get as much of that before December 31st. We do know sometimes there's a lag. Anytime we have a transition, sometimes there are problems with coverage being affected, getting prescriptions filled. So get as much done before December 31st as possible. Each family member will get their own card. I know under United Healthcare, you would get 2 cards. Under Blue Cross Blue Shield, every covered member in your household will have their own card. So if you have a child that's away from home that's still on your plan, he or she will have their own card. Your wife, any dependent will have their own card. United Healthcare and Cigna will no longer be available to us. So when you go online for open enrollment, you will not even see an option for Cigna or United Healthcare. our plan choices. We have the HRA Gold, the HRA Silver, and the HRA Bronze. All of the plans this year are the consumer-driven health reimbursement agreement. We will not have any HMO. We will not have any high deductible options. Every plan will be the health reimbursement agreement plan. So if you are familiar with how that process works, then you're already ahead of the game. If this is going to be brand new to you, you really need to read the information that's going to be distributed. So we don't have a choice when it comes to that. We don't have a choice as to the wellness or the standard. It's just a flat plan, and these are the choices for us. You can imagine that the gold, of course, is going to be the higher coverage policy. The silver is mid-level, and the bronze is going to be your basic coverage. The plan that's most comparable to what we currently have now is the silver plan, right in the middle. So if you are right now in the United Healthcare or Cigna HRA plan, the silver plan, Blue Cross Blue Shield Silver, is most comparable to what we have right now. Any questions about that? Yeah, but right now, it will no longer be wellness or standard. It's just going to be HRA. But right now, if you have the HRA wellness, then that's most comparable to the Blue Cross Blue Shield Silver. Okay? Any other questions? Okay, State Health has given us just a plan design where you can compare the three plans. And I've also included that in the email that went out for you this morning. And you can see what the major differences are going to be: the deductible, the out-of-pocket maximum, and your HRA credit dollars. So with the basic plan, your deductible, let's just say for a single person, is going to be $2,500. You will have, and then they'll give you 100 credit dollars. They'll start you out with those 100 credit dollars. And then the plan will pay at 75% once you've met your deductible. So let me remind you how this works with the HRA. You start out with that first dollar coverage, like that $100 that they give you. Maybe you had some credits from last year, and we'll talk about that more. Once you've spent down your first dollar coverage, you have to meet your deductible. Once you've met your deductible, then the plan will start paying at that percentage amount. So for the bronze plan, it will pay at 75%. For the silver plan, it's going to pay at 80%. And for the gold plan, it's going to pay at 85%. So let me say it to you again. You'll spend down your first dollar coverage. After you've spent that first dollar coverage, you have to meet your deductible. After your deductible is met, then the plan will start paying again. Yes, Mr. Little.
So the money we have, that upfront money, does not go to deductible on past United Healthcare?
The upfront money,
$dollars that we have, that went to our deductible, that does not go to the deductible line?
your upfront money, yeah, your first dollar coverage will reduce your deductible by that dollar amount. So let's say if it's a single person on a bronze plan, they're given $100. Their actual out-of-pocket, their deductible is going to be $2,400 because we take off the first dollar coverage from that. Thank you, Ms. Doolittle. Then once you've met the $2,400 deductible, the plan will start to pay. The way to try and maximize this benefit under the Affordable Care Act, any services that we have that are considered wellness, like a routine checkup, certain exams, maybe a mammogram, those are still covered at 100%. And that will not affect your HRA credits. So you want to utilize the wellness benefit. Any other questions about how that works?
So if you went in for a physical wellness in the HMO, you have a code, there's no co-pay, they pay 100% of the visit?
Right, there's no co-insurance. So you go, all is well, it's routine checkup. Your doctor codes it as a wellness visit. It's covered at 100%. You don't pay anything.
What is our copay?
It will. Now, once you've used your first dollar coverage, met your deductible, the copay on a bronze plan for you would be 25%. The copay on the silver is 20%, and then a copay on the gold is 15%. So that would be our co-insurance amount. So, yeah, the co-insurance is different according to the plan.
Can you tell us the difference between network provider and out-of-network?
Good question. Network and out-of-network. The in-network providers are considered in-network. If you go out-of-network, the plan is only going to pay 60%. So if you have a $100 bill and you go to an in-network provider and, you know, for that particular service, your charge is $100, you've met your deductible, blah, 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 you would only have to pay $25 of that if you were in a bronze plan. If you go out-of-network, you would have to pay $40 because it's out-of-network. They only pay 60% for out-of-network services. This is important to remember. Wellness, you know, the things we talk about, things that are covered at 100%, you must use an in-network provider. Otherwise, they will not pay anything for you.
Are most of the United Healthcare providers also Blue Cross Blue Shield?
Yes, Ms. Harris, it was explained to us that 97% of the physicians in the United Healthcare Network are also in the Blue Cross and Blue Shield of Georgia Network. And in the email I sent out this morning, there's the website to go to Blue Cross and Blue Shield to make sure that your physicians are in network, or you can actually call them to make sure. And really the best practice is to call your doctor. Any other questions? They've given us an overview of some of the benefits of people that are in the HMO plan now. Once you go to one of the metallic plans, you'll see reduced premium. But you can decipher that based on the premiums because you know what you're paying now, and you know if you're going to see a reduction in your premium. If you go with a silver plan, you will see an increase. If you go with a bronze plan, you will see a decrease. Now, this is very important for people already utilizing the HRA plan. If you had unused dollars, say if you had a really good year, you didn't use your credit dollars, and maybe you have 500 credit dollars, they will roll over into next plan year for you. They will roll into your account around March of 2014. So those credit dollars are not lost. They will roll into your account March of 2014. Also, if you participated in those wellness initiatives, remember we had to do those things to get the extra dollars? If you did it and your spouse did it, those will also show up on your account January the 1st. So we won't have to wait for those. And that was an additional 240 credit dollars. And if your spouse did it, that's an additional 240 credit dollars. So that's a good advantage there. So we won't lose any of those HRA dollars that we have accrued. They will just roll in March of 2014. Any questions about the credit dollars?
And they'll still count towards the deductible.
They will still count towards your deductible. Now this is going to be new. This is something that's going to be, I think it's going to be a good benefit for us. For the 2014 plan year, Blue Cross and Blue Shield will give us an opportunity to earn an additional 480 credit dollars. And what we'll have to do, they want us to do a biometric screening again, and we will have on-site visits this year. We're waiting for them to send out the date so I could go ahead and reserve a date for our area. Also, we have to do an online, they call it a well-being assessment. They want us to answer those questions again. And then we have to do a coaching module. Either we can do it by phone or we can do it online. But assuming that we do all three of these items, we can get an additional $480 into our plan for the year. So that's something to think about when we start pushing those emails about it. If you're able to do it, just go ahead and do it because it will benefit you. Any questions about that?
And that's
tells you what you have to do. They want you to go online and do the health assessment, know your numbers. That means your biometric screening. And remember, it was the body fat, blood glucose, cholesterol, blood pressure, and I think our weight was included in that. And then the take action, the coaching pathway, that's where we can actually talk to a person on the phone, or we can go online and pace ourselves and do the modules that they have available. So you can decide which one works best. But assuming you're able to do all of those, that's an additional $480. And if you do it and your spouse does it, that's 480 times 2. So that would be a benefit for us. I mentioned that this is very important for some of us. If you are currently getting treatment for a serious medical condition, and they don't think, a serious medical condition, and if your physician is not currently in the network, you can contact Blue Cross and Blue Shield and request a transition of care. What they'll do in that case, it goes through a process, and if it is approved, they will allow that physician to be treated as an in-network provider for the remainder of your care. So if you have a serious health condition, some things have come up that you're concerned about, and if you see that your doctor is not in the network, immediately start the process for consideration for transition of care. Any questions about that? And I'll just share this with you because we had to send out our notices about the Affordable Care Act. The Washington County Board of Education, we are in compliance with the ACA. We have a product available that is what they consider affordable. So we have met our obligation under the ACA. And the marketplace information we send out, I know that stuff is confusing. All that says to you is we have a product here. It is subsidized by your employer. If you choose to go out into the marketplace, you certainly have that option to do so. You will not be eligible for federal subsidies if you use a marketplace vendor, because we have a product here that we subsidize for you. Any questions about that? I know that was a lot of information. Did you have any questions about that handout? All right, the rest of this, these are just reports that we have to file. Any questions for me about state health, about the medical insurance? I'm not sure let's see if I can get this go to slideshow.
Ms. Fowler,
Yes.
what about our vision and dental? Is that
Yeah,
changed?
we're going to talk about that right now. I
Okay.
was just trying to bring up that slide. Thank you. Yes. Right, and that's in our handout that I sent this, it is not. The prescription, and this is what I found interesting, the prescription coverage on all 3 plans is exactly the same. Exactly the same. So if you are a person that really needs your insurance for prescriptions, the co-insurance is exactly the same, whether you get the gold product or the bronze product. So that's something to bear in mind. But it does not go towards your deductible or your out-of-pocket maximum, the prescription co-payments. Any other questions?
I'm not sure of the amount, but you know how some of us have the prescription plan where you have a certain amount of money to spend. I don't have the, I don't think so. You know, like where you have like $500 or something per year, and you get your prescriptions up to that, and then you have to pay the co-pays and stuff after that.
Right, and what you're speaking about, that's the first dollar coverage. That's not the healthcare spending card.
Right.
Okay, that's what the insurance company starts us out with, that first dollar coverage. It could be used for prescriptions or for medical visits. This is something else about that first dollar coverage. If you have dollars in your account and you need to get prescriptions filled, it will default, it's automatically going to charge your account for the prescriptions. Last year, they gave us the option to turn it off. I don't know if anyone took advantage of that, but it was much less expensive if you were getting prescriptions outside of that coverage. That's no longer an option for us. They make us use our credit dollars for 2014 for prescriptions. Any other questions? The dates are the same for the flexible benefits, and our flexible benefits cover dental, vision, voluntary life, long-term care, short-term disability, health care, independent care, spending accounts, and the legal insurance. Let me just tell you, again, I've sent it in an email, it is not necessary to sign up for the long-term disability at Georgia Freeze. The Board of Education provides a long-term disability policy for you at no cost. So you do not need to pay that extra premium. It's just an added expense. I know some people have enrolled in it that really did not need to. And if you have, go in and drop it so you don't have to pay for that. First change, MetLife will become the life insurance company for January 2014. It was Minnesota Life. Now we're going to have the coverage under MetLife. They say to us that we're going to get a better service under MetLife, better product. What they're also going to do, they have increased the amount of life insurance that we can take out. Every year they increase that life insurance amount. So now you can get up to a $2 million policy. Of course, that does require some medical underwriting. So if you are inclined to do so, you can take out up to $2 million.
Can I put that on my wife right now?
Yeah. So there's someone out there that wants that insurance. But anyway, you'll have that privilege to do it. Also, they say that we will have decreased premiums. They haven't published that for us yet. So when you go and log in, you'll see what the premium amount is according to your age and life expectancy. Any questions about that? They are also giving us something that I thought was pretty good. They have reinstituted the waiver of premium. If anyone has ever been out on disability or, was utilizing a short-term disability and your check is being docked, now we can do a waiver of premium. So when you're not earning income, they can waive the premium for you when you need it the most. So I thought that was a pretty good benefit. They're going to allow us to do that. Also, everything is a process. You would have to fill out paperwork if that applied to you, and they mail you that information. They're also going to give us will preparation and estate planning. They didn't give us a whole lot of detail about how this would work, if we need to contact a local attorney. So I'm hoping when they put their plan guide out, they can tell us what we can do. So this is an added benefit. We'll be able to have our wills revised, do some estate planning. So if you have the life insurance, please try and look at taking advantage of that. Any questions about that? This is something new, the accidental death and dismemberment. They're allowing us to increase our limits on that to $2 million. And now they've increased the dismemberment payment from 50% to 75%. If someone is dismembered, if you lose an arm or a leg, they will pay you 75% of the value of your policy. So that's something that they've improved on. This is new, this is important. Our vision insurance provider will also be Blue Cross Blue Shield of Georgia. We still have the same in-network providers. It's still Walmart Vision Centers, and they've given us a list of Walmart Vision Centers that will file claims for us. But Blue Cross Blue Shield will also be our vision insurance provider for plan year 2014. They have enhanced the out-of-network benefits. I know a lot of people like to use their ophthalmologist or optometrist, and that's fine. You can certainly go out-of-network, but you are required to pay up front and then file a claim. So they've increased the amount of reimbursement for those out-of-network services. So that's a breakdown of what that would entail to you. And also, this is very good. They're going to allow us to get new frames and lenses every 12 months. So if someone wants to get glasses every single year, you'll be able to do that now. And we have a decrease in premium. I think it was like 40 cents, but still we have a decrease in premium that we'll pay monthly for those plans. And this is just an overview. All of this is going to be available when you go online to the Georgia Breeze website. And I encourage you, please go online, because you need to look at this, especially for the state health. You need to go online and look at the plan option that you want to enroll in. If you do nothing for a state health benefit plan, they will default you into the bronze plan. And some people, that's fine, you know, but you do need to just go online and then you make the choice as to what you want to be enrolled in.
Is that?
Yes.
Georgia Breeze is the same enrollment period as
Yeah, it's the same, October 21st through November 8th. They're all on the same dates. And this is a rundown of the Walmart Vision Centers that are in network. And I did take a look. The one in Milledgeville was on this, and it has the information there. They have one. They're kind of spread about. I did not see one for Augusta. The closest is the Walmart Vision Center in Milledgeville on North Columbia. Premiums will be, this is the Select plan, and this is for the Select Plus plan. The coverage is slightly better for the Select Plus plan, and the difference is not that significant. This is another enhancement. Anyone that's out on disability, they've increased the weekly amount from $800 to $1,000. So if you have a disability claim and you have to be out for an extended period, they have increased the amount that you can actually get. There is a long-term disability. We're not going to worry about that, right? Because the Board of Education covers us with that. So you don't have to worry about the long-term premiums. And plus, their rates went up. So I think we can beat them hands down. Specified illness, they have added, there are two benefits that are different this year. If you are in a specified illness plan, and if you have utilized it, you get your annual, and send in your claim, you know, they send us that $100 reimbursement. Remember last year, people started getting them in the mail. But this year, if you're in a specified illness with the accident policy, they're going to give you $160, and they pay it back directly to you. So if you look at it from one respect, it can offset the cost you're paying for the premiums to have the coverage. And they've added 4 diseases: cystic fibrosis, cerebral palsy, cleft lip or cleft palate, and spina bifida. And this is for our children. Our children are covered under this policy. So they've added 4 illnesses that would cover diseases that children may have. Any questions about that? The spending account, this year, you know, the healthcare spending card, that's where we take out a certain amount of money each month, and we have that little ADP Visa card that we can use for medically related purchases. This year, you have to go in and re-elect the amount of money that you want. Last year, they just automatically rolled you into the same amount, whatever you were contributing rolled over. This year, they want us to go in and re-elect our deduction amount. So make sure if you're in a healthcare spending or dependent care account that you go in and make the election as to how much money you want deducted monthly. Long-term care, for the few people that have it, there's going to be a 15% increase. And you should have already, if not, received this in the mail, but it will be forthcoming, telling you what your new premium will be. So we don't have a whole lot of people enrolled in that at the moment. All right, here's some reminders. This is the communication. They've already started sending stuff out. I hope you've received some of that information in the mail. I encourage you, if you're not sure what your password is, go ahead and try and go into Georgia Breeze or call them and have it reset. Because we ran into problems with that last year. If you wait till the last minute, it is hard to get through to someone on the phone. Keep your confirmation number again. Whatever changes, elections you make, keep your confirmation number. If there's any dispute, they'll be able to go back and research your transaction. The You Decide booklet, they sent us an email. It is not online. They sent us an email. They hope to have that available by the 15th as well. And when you go to Georgia Breeze, you'll see it on the website when you decide what you want to choose. So hopefully they'll have it up and ready by the time we start our enrollment process. Okay, these are just reports that we have to file. Any questions about the flexible benefits? Any questions, anything about state health that I might have missed? Yes, Ms. Harmon.
Was there any of the surcharges that they got in the past?
Yeah, now they've eliminated the spousal surcharge. The tobacco surcharge is still $80. And let me just,
They have no spousal?
no spousal surcharge. They've calculated that into the premium. So it didn't go away, they just found a different way to charge you. Any other questions? Okay, and just to review what was sent out, what's available, and you really, Peach Care is out there. If you have dependent children and you think that you fall within that income criteria, apply for Peach Care if you think it will help you financially. So Peach Care is an option, TRICARE. We know that Blue Cross and Blue Shield HRA will be our options for 2014. We cannot enroll in an HMO plan or a high deductible plan. They have eliminated the wellness and standard options. It's just one basic plan for everyone. The surcharges, they have eliminated the spousal surcharge. There will be the $80 tobacco surcharge. Our credits, if you completed your wellness requirement for 2013, these credits will be posted into your account on January 1st, 2014. Any remaining credits will go into your account March 2014. The wellness incentives, they want us to do the online assessment, they want us to have a coach, and they want us to do the biometric screening. That can earn us an additional $480. So please take advantage of that. Prescriptions, Express Scripts, the co-insurance is the same from all three plans, and it does not apply to our deductible or our out-of-pocket maximum. Your choices are bronze, silver, or gold. Bronze is basic, silver is mid-level, gold is high-level. In-network providers, I've given you the website. Go see if your doctor is in network. I've given you the phone number. Call Blue Cross Blue Shield. Call your doctor and find out if they are in network. Also remember, if you're undergoing medical treatment and think you need a transition of care, get started on that so when January 1st comes, you're still able to go to your same physician. They're not going to print the decision guides. We'll do the same thing we did last year. We'll send it out as an email. We'll post it on our website. Reminder to you that we offer you long-term disability insurance. You do not have to sign up for that. Remember this when you go for your dental insurance. Do not sign up for the dental HMO. That is only for people in Atlanta. We've asked them to try and block it so our employees do not see it, but they're unable to do it because that web serves the state of Georgia. The dental HMO is not going to benefit you in this area, and they're not very forgiving about letting us switch out. So if you want to enroll in dental, the Delta Dental is the plan that you want to look at. The Plus plan has coverage for orthodontics, and this does include adult orthodontics. The basic plan does not. So if you think that's something you want to look at, please read the information. Blue Cross and Blue Shield will be our vision provider. There's going to be a decrease in premium and enhanced out-of-network coverage. Your short-term disability, they've increased the maximum you can get on a weekly basis to $1,000, and they are waiving the premium for those individuals on disability. The voluntary term life, MetLife, will be our provider now. We'll have better benefits, and we can also take advantage of will and estate planning. Specified illness, they've added those illnesses I told you about, the cystic fibrosis, cerebral palsy, cleft lip, and cleft palate, and spina bifida. Also, remember that you can get $160 by just complete a wellness screening, and they'll mail you a check. The health care and dependent care spending accounts, make sure you go in and re-enter your contribution. Whatever you want it to be for next year, you have to re-enter it. There have been no changes to the legal insurance. I've also given you information as a reminder about Lincoln. They've asked us to do this to remind you that you can contribute to the 403B. Joe will be here on Thursday, so if you think you still need an appointment, send me an email. We still had some spaces available. It's important from time to time to meet with Joe Stallings just to check on the financial well-being of your 403B annuity. Now, with all of that having been said, what questions do you have for me?
I have one question for a friend that's retired. In the past, they have not had to go online, as people rolled over. Alternatives is going to do that, or do they go into this?
Now, if they're under the age of 65, then they do need to go in and make it.
They're over age 65,
They don't. If they're over 65, they're in Medicare Advantage, and they will be automatically rolled over. Any other questions? Well, if you think of anything later, just send me an email, and I thank you for your time. Thank you, Dr. Brown.
Go ahead and use this since it's already hooked up. I'd like to thank Ms. Battle again for coming in. We've recorded it. So I don't know where Ms. Brantley is going to post it.
Tell her to get her thumb drive.
Ms. Battle, you need your thumb drive.
Sorry.
Sir, what did you ask me?
I know you recorded it. Where you going to post it?
It should go straight to YouTube.
All right. She said it'll go straight to YouTube. So we'll be
It should.
It should. So we'll be nationwide on our Washington County Insurance meeting. All right, just a few housekeeping things, and I'm going to let you go because I know we've got a lot of stuff we have to cover. Appreciate your efforts on the intruder and the fire drill, and that's just what it is. It's a drill. So I know we have some things, especially an intruder and getting them transitioned in the hallways, but we'll continue doing that. And I know some departments that we did miss. We'll get with you all next week to make sure you go through the practice process. So I appreciate your efforts on that. And so that was a block that we were able to check. You know, supervision, that's always important. I always mention it because that's a showstopper if we're not doing that properly. As you all know, the morning duty has changed just a little bit with the transition or the changes we made to how the students are now to conduct themselves in the cafeteria. So with that being said, it kind of changes our duty a little bit. Now our main thing now is staying on top of making sure that if they're up doing something productive and not just standing at the table having a conversation. Now that doesn't mean if you see one up, just go down on them, because what it means, and you'll know it, if they're standing there for a while and you just see them kind of not doing anything and just kind of having a conversation, if we'll walk towards them and ask them, just nice, you can sit, I'll tell them, you just pull a chair and sit right there, but you can't stand up and talk. And then a lot of times if they see you coming, they'll go ahead and sit down. But that's something should have did it 6 years ago, but that's something that has been really, I've been surprised at how well it's working. But we still have to stay up, we still have to stay up on it, because if we get relaxed, then they're going to get relaxed. So let's just stay on them. And like I said, it doesn't have to be a, kind of a Sergeant Carter type thing, sit down, right? Don't have to be that. But just, you have your sector, just kind of keep an eye on your sector. And if you see one up, kind of just not doing anything productive, then if you just kind of move towards them and ask them to sit down. Now, of course, if they run their mouth and give lip, then, that's when you can involve us on the process. But it's been going pretty good. They get up, go to the restroom, throw their trash away, get their breakfast. And right at the beginning, it's a little bit of a transition period because they're coming in getting their breakfast, sitting down, fixing their clothes, fixing their belt. Some of them stand up and fix their belt so long, I just start telling them to go in the bathroom. You need to go in the bathroom and fix your clothes because it takes you too long. But as the breakfast lines go down and then they're just in there eating, that's when it's real vital that we watch them and make sure that they're sitting down. And if everybody covers their sector, I think we'll be okay. I shouldn't have to have a teacher coming from over by the serving lines all the way across to somebody standing up by the booths, all the way down to somebody, that's by the stage. So I think we have people positioned in each area. So if you just cover your sector, I think that would help us stay on top of that. And also, please, from time to time, just check your schedule. And I know it's a time in between, and sometimes you can forget that your morning duty is coming up. But if you look at the date and kind of just stick it in the back of your mind, then when it gets close, something will trigger in your mind. And if you just check it, then that way we'll have everybody there on when they're supposed to. Walkthroughs will start next week. So we'll start kind of visiting your classrooms on walkthroughs. And basically it's based on the 10 standards. We all know what they are. Now don't get alarmed if you see all of us walk in your room at one time, because what we're doing is we're trying to calibrate ourselves. We're trying to make sure that as we do a walkthrough, we're going to come out of your room and then we're going to talk about the things that we've seen and didn't and have not seen, to make sure that we're all on the same page, so the walkthroughs won't be looking like this, okay? So we're going to try to come together. So if you see 5 of us come in there or 4 of us come in there, just continue what you're doing. That's just for us. And then we'll step out in the hall after 10 minutes and talk about what we've seen and make sure that we're all kind of seeing the same thing. So don't worry about it. And remember, it's this new teach process. We're gonna crawl through this thing, and we've incorporated you all into most of it, just so that next year won't be something totally new. And I tell you, I really do. I mean, we at 100%. Everything up to the walkthroughs, everybody has completed, checked it off, pre-evaluations. So next year when this come around, it's just something that we do. And in saying that, the group that is going to go through the entire process, I think Ms. Binion will be here at 2:30. We have some type of one more step that we need to do. So if y'all will be on standby to meet with her. Okay, also in the walkthroughs, remember your standard-based classroom, how your standard-based classroom should look and what goes on the boards. Make sure that your lesson plans and things are in the folder on the wall. So when we come in, because sometimes if we look at your board and in your lesson plan, you may be on that day or you may not be on that day. So if I look at your lesson plan and it says you're doing something on Tuesday, and you didn't quite cover it all on Monday, then I can look at Monday and then that'll tell me, okay, well, they're still trying to get this stuff done from Monday. Okay, and that way the least interruption that we can have you when we come in and do better. So make sure all that stuff is up. Just a few things on discipline. Just want to kind of bring you in the loop on some things that's been going on discipline-wise. We all know about the big thing in the cafeteria and why we went to having students sit down and everything like that. Then we had some students, a young lady, she bought 10 football tickets, and some students young man went in her bag and got the football tickets. And I've got most of them back. I apologize for that email I sent out, because I didn't know the numbers. I was just trying to shake the trees and see what fell out. And when I sent out that one, I had one young lady come to me, brought the ticket back, and told me who she bought it from. So once I got that one name, then I was able to almost solved the whole situation. But I got it towards the end of the day, and so I'll be finishing up everything on that on Tuesday. You can turn this part off